Because of the people behind it, more than anything else. I've seen the quality and the approach to the way they do things. There's a certain thoroughness, there's a certain standard, almost it's the standard of excellence that you can obviously see the group of people are trying to attain. And that's what's caught my attention. Also, having spoken with Anoop in the past and seen, we've discussed things that we feel are missing from most of these two-day courses that are going on, where you walk away and you're sort of thinking, well, you've got the mechanics of how to put brackets onto teeth, but you still don't know why you're doing it and exactly what you're doing.
And we'd done some orthodontic courses before, which were an anterior alignment, and felt a little bit lost and a little bit out of control with the predictability. And when we saw that both Ross Hobson and particularly Anoop were running this, it made us feel quite comfortable. We've got great respect for both of them.
I know Ross Hobson, I know he's absolutely fantastic. I know that he wouldn't put his name to anything that wasn't rock solid. I know Anoop, and I just know that I'm getting the support that I need to deliver the right patient care at the right time.
I have been a 6-month Smile provider now for a number of years and have very much enjoyed doing that type of orthodontic work. But I just felt that I needed to learn more, and I needed more backing and more supervision from orthodontic consultants.
Well, I've done 2 other orthodontic systems, Invisalign and 6-month Smile, and I was just getting a bit frustrated with I couldn't get the end result that I wanted to get, and I didn't feel like I was getting as much support as I wanted.
I'm already an Inman aligner provider, but it does have its limitations. I had been looking at other courses like 6-month Smiles and CFast, but wasn't overly convinced, especially with 6 months, because the labs are within the US. I wanted something UK based, and already having a relationship with yourselves through Inman, it was a great opportunity.
I've been doing anterior alignment orthodontics for a number of years. I was a mentor for one of the other providers. And actually, it was what I felt as the more cases I did, the more I realised how little I actually knew about how to treat certain cases, and when things go wrong, what do you actually do? How much support do you really have? And I think that's really what drove me to start thinking along the pathway. And the ClearSmile Brace system, when it came up, was ideal for that.
I've enjoyed it. I've done different types of general practitioner orthodontics, I mean, in the past, not massive amounts. But this one has left me feeling a lot more confident in that I actually understand why I'm doing what I'm doing. There's a big emphasis on assessment of the patient, proper records, diagnosis. So going forward, just looking at the cases that I've brought along, I feel I'm going to be far more confident. And also the fact that there's this mentorship behind you. It's UK based. And yeah, that's really and I'm really pleased that I've done it.
Oh, I think it's a great wee system. I cannot wait to start. I've got a couple of patients lined up for it. The way the course has been delivered has been excellent. The limitations have been explained about what can be achieved through fixed that I couldn't through a removable is exciting. And as I say, I'm quite keen to just get on with it, really.
Oh, it's brilliant. It's really good standard. It's the same standards as the Inman aligner and the ClearSmile. And I love it because it's really systematic and it helps me with my treatment planning. So yeah, it's what I need.
It's been fantastic. It's been really good to actually go to a course that builds on the existing knowledge that you have. And takes it to the next level, gives you the confidence to know your limitations and is very upfront and clear about what the limitations are and where you need to stop and where you need to refer, and actually just allow you to the freedom to be able to treat cases comfortably.
The speaker's been excellent. He is very knowledgeable. He certainly knows his stuff. He's very approachable. He's quite a funny guy, so he kept us all engrossed and engaged because there's a lot of material to cover in 2 days. But he made it fun, he made it intuitive, and I've thoroughly enjoyed it.
Anoop's excellent. He's a great personality and able to present a vast amount of knowledge in a easy to digest way.
Oh, he's great, isn't he? He's very funny, and he's a great public speaker, isn't he? He makes it interesting and he makes it enjoyable.
I've known Anoop for a long time. He's a brilliant speaker. He's absolutely fantastic. He simplifies topics that other speakers may make a lot more complicated than they should. And that's one of the joys of today. He's made this a very enjoyable topic, and he's really broken it down and simplified it significantly and just made it very approachable.
I'd rather not name them, but I will say that none of them go into the depth that this one has gone into. Going back and reflecting, quite often you get caught up in the excitement and maybe charisma of a speaker, and you go away thinking you're going to do wonderful things, and there's quite a bit of pressure sometimes to buy a number of cases only available at the course. There's none of that going on here. So for me, I just feel this is the way it should be done.
One thing which stands out to me is it seems a lot more ethical, and also there's a large element of quality assurance which is going to be beneficial for my patients, but is also giving me a lot more confidence to provide this treatment.
The main thing, as far as I'm concerned, is that I'm not an orthodontist, but I feel comfortable that now I can have backup from locally trained consultants.
I originally started with 6 month smiles about 4 years ago. It's got its limitations, and I think this course just helps you appreciate what those limitations are and what is within your competency.
I've done 6 month smiles level 1 twice. I've done the level 2 course. It's all great grounding, but this seems to be much more solid. The ethics of it are better. It just seems so much more organised, planned, and in control.
6 month smile is a bit wow, and everything's easy and everything you can do, and and it seems to be a bit more sensible, this one, and a much more structured approach.
I would absolutely recommend this course. Tim, for me to recommend something, I'm not just going to say it lightly. I'd rather say I'm not going to say anything, but if I'm going to say I recommend something, I genuinely recommend it for all the right reasons. Number one, you're learning to do things the right way. Your patient is safe. If you're doing things this way, you're doing a proper assessment, you're doing proper records, you know what you're going to do. You've got to understand, before you can come to a prescription for the patient's treatment, you've got to understand why you're getting there. You've got mentors behind you watching every step that you're taking. Highly recommend it. Highly recommend it.
Wholeheartedly. I feel that every GDP can benefit from this, that's providing orthodontics, and it's ultimately going to lead to improved care and hopefully stem the rising flow of litigation which is happening.
Oh, I would definitely recommend this course. I think anyone who actually does any sort of orthodontic movement in general practice should be taking a course like this.
Oh, absolutely. It's a brilliant course to give you the confidence to be able to know your limitations right from the start, to know what cases you can do, what cases you can't do, and also just to give you the confidence as a GDP to know that what you are doing is well within your remit, and to know what you shouldn't be getting yourself involved in.
Excellent.
Fantastic.
It's great.
Brilliant.
Enlightening.
Fantastic.